So a patient-centered medical home in a nutshell is returning back to the way it was supposed to be 25 years ago, where you have an investment of the patient with their own accountability, partnering with you as their healthcare provider to make sure you give them the best opportunity for good outcomes. Not a complex process, but one that takes a little bit of change in thought process from where we've really been in medicine over the last 20 years. We are going to be maybe a little more involved in making sure you come back. Through Cerner, our patient information system with the health systems, we have an ability to more accurately and real time know who and who aren't in compliance and being seen. Before we had medical information and the technology we have, it was a very arduous paper-based task. So what you now see as a patient is someone calling you in advance, getting you in here for your labs before your visit, coming in and putting you through a pre-screening process. Those things, those protocols, just the process is what's different, because it's a lot more front-loaded, so that the time I spend with the patient isn't a lot of paperwork. That's all been done. So it's much more efficient for the patient. We have all of the information we need as a physician to make a lot more of the diagnoses and medical changes and recommendations real time. And then with the medical home nurse, she can come in, follow up with patient information, follow up with further, personalized instruction for that patient based upon the direction that I've given to the nurse and what the nurse and the patient can do together. So when the patient leaves, there's not a lot of hanging fruit. Everything's been directed and addressed. With the medical information stuff we have, we can then follow that patient up much more effectively.